that's why he's doing it. So we need to increase the competencies of the healthcare workers rather than penalize them so that we can promote patient safety. Are you all with me now? Till now, can you follow what I'm trying to tell you? It's a serious topic to tell a 18-year-old. Just wanted to make sure that you all are grasping what I'm trying to tell you. Okay? So that is why we need training, awareness to increase your competencies. And how do I train you? I can train you to put a cannula, IV line. I can train you to diagnose something. I can train you to put a tube inside. I can train you to identify some murmur or some respiratory problem. How do I train you in teamwork? How do I tell you this is the way you need to talk to the nurse when you don't know what the nurse is supposed to do? And that is why we have training on teamwork, and it's so important. Very easy to say. So we have, are we done? Yeah, thank you. When patient safety research, you can clearly see here, the major cause of adverse events is poorly designed system, not negligent individual performance. It is there. And we need to work together in teams to redesign the flawed process. And that is why so much importance on teamwork, especially healthcare teamwork, okay? That same year, the Institute of Medicine has said, so what methodology do we use to teach or train our healthcare workers? They have mentioned simulation technology, where I will be talking in the later end of my session, what is that simulation? But it improves individual and team performance through interdisciplinary team training. So this is one tool we have, one methodology we have to target the teamwork and communication skills, okay? All of you agree? No? Anybody who doesn't agree? All of you sitting here are very blessed, right, to get the seat for medical? Yes? So many waiting in line, waiting for you all to leave the course and leave the college and go somewhere else so that he or she can come. You are given an opportunity, and please make sure, starting from this month till you finish, it's lifelong learning. I'm learning today. Me and Reshma are students in a fellowship course together. We're still learning today. So take the opportunity whenever an opportunity comes in front of you to learn, because you owe it to the society for patient safety. Tomorrow, that patient might be your mother or father. Think that way. Then you better make sure that you learn the right competencies. So what we're going to do right now is, okay, we have a big group. We have 4 teams. Okay, I'm going to make you all into 4 groups, just to get you all a little charged up. She'll start from here. What's your name, dear? Shreya, okay. And from here, what's your name? Ranjita. What's your name? Fahim. Sudarshan, okay. So these are going to be your team leaders for each team. What I want you to do is, I'm going to time you all, okay? All of you know your names? Anybody who doesn't know their name? Okay. You know how old are you? Yes? What I want you to do is, each team leader is going to start, they'll say their name out. And look at the minute they say their name, they look at the other person, or you can touch the other person, it's up to you. And that person tells his or her name, and it goes on, that impulse goes on till the last person. Okay, I'm going to time who's going to do it fast. The last person is going to stand up, tell his name, okay? He's going to tell his age, and that impulse is going to come back. Is it clear? And I'm going to time. So each team is given the same task. Let's see how you all do it. I will tell you, start. Any queries? You want a discussion? The team leader wants to brief anybody? You all decide? You have a team structure? Yes, we have a very active team leader who's already stood up. Okay. I'm going to time you all. All you have to say is your name as fast as possible so that I can finish the introduction also. My name is Lulu and my age is 43. Now, you'll be saying your name first, okay? You'll go down, right down, and then the last person is going to bring back the age. Is that clear? Any doubts? Okay. So I'm going to start right now. On your mark, get set, go. Let the age come back. Let the age come back. Reached? Yes, a big applause. They took 51 seconds. Okay. Now let's do another way. Now I want all the 4 teams to do it together. This time, we are very blessed. All of you know your mother's name, your father's name. I tried this game at another place, and I used only mother's name, and the boys got offended. Ma'am, next round, father's name. So I make it a point that we have to say the father's name also. Now what you're going to do is, she's going to start, Shreya, right? Yeah. Shreya is going to start with her mother's name, and it's going to go, through all the groups. Okay? It's going to be a wider circle with all the groups till wherever it ends. At the same time, who's the last person there, ma? What's your name? Ajin. Okay. So he is going to tell his father's name at the same time. Both of them are starting together. She says the mother's name, he says the father's name, and it's going to come back to all the teams. So somewhere in between, it's going to, clash, okay? But it has to reach. Understood? So you're going to get the mother's name backwards and the father's name in front. Are you all ready, both of you? Your time starts. Anybody wants to practice their mother's and father's name? Okay. We are really blessed. We have a mother and a father to pronounce their names. At least remember them today. Yes. Start. going to give you a toolkit where there are few tools, how to enhance team performance and improve patient safety, okay? I'm going to follow a framework which was introduced by the Agency for Healthcare Research and Quality, US. It's called Team Steps. This framework helps us and gives us a few tools for all the competencies I've written here. These are team competencies, okay? You had a team structure. Didn't you all have some structure? Was there a leadership? Somebody at least to start the show? Was there communication? And you had a lot of problems there, right? Okay. Was there situation awareness? Each one had to know what was happening because their role and responsibility depended on that. Was there mutual support? Okay, I saw somebody, telling, hey, it's your turn, it's going to come and all that. Okay. So based on these competencies set by team steps, there's an extra P because it is strategies and tools to enhance performance and patient safety. Whose performance? The team's performance. This framework is available on public domain. I'm a master trainer for this, so I'm going to use this framework to teach you a few tools. Since you all have not yet entered healthcare setup, I'm going to try to do it with a few animated videos just to get that competencies in your head, okay? How did you all form a team? What's the difference between a team and a group? A group can reach the outcome even with individual performance. A team, they need to interact. You all were interacting. Interdependent, okay? That you achieve your task is dependent on everyone in the team, not just you. You have a common and valued goal. All of you had a common task to finish. You have specific roles, and you have a time-limited membership. So in healthcare, this is the team we are going to talk about. So first, I'll just talk about teamwork, and then just introduce you to interprofessional teamwork. When we say individual competencies, you know you have to improve your knowledge. Most of your undergraduate period is going to be the cognitive domain, increasing your knowledge. MCI has set forth a few psychomotor skills which you need individually, and obviously your attitude and communication in your affective domain. But even in a team, these competencies are important, okay? The knowledge part, the skills part, the attitudes part, that is also important. With the patient in the center, these are the key principles which we are going to talk about today. Just remember these key principles when you are a member of a healthcare team. Now, when I talk about team structure, like I said, it is all, the center is always the patient. It is patient-centered. And don't forget that that patient is a part of your healthcare team. The patient family members are a part of your healthcare team. Never forget that. Now we have a core team, the nurse and the doctor and maybe the physiotherapist or anyone who is directly giving care to the patient. They form the core team. Now if emergency help is needed, you have an ICU team or you have a code blue team. That's called contingency team. For short duration in emergencies, they come and take care of the patient. But the core team is responsible for the patient. Then you have your coordinating team who helps with all the direct care services. You have your ancillary and support service, like somebody was telling. And in the end, you have the policy makers who ensures there's a patient safety culture in that institute. Okay, so this forms your team structure in a healthcare. Anybody watch this video? Movie, Bug's Life? Okay, so just look at the video and then we'll have a discussion. Sorry, still keeps. don't think anybody heard what was happening. I could only hear in this speaker. Anyway, we can increase the volume. No, this volume. There's no way you can increase. Okay, 1 second. Just give me 2 minutes. No, I'll just increase the volume. No, I don't really need that. We'll just try. Okay, we'll just have a discussion till hopefully because I have a lot of videos, so without the audio it's not possible to continue. They need to, you know how ants walk, right, with the foot? Okay, now a twig has come in front. For that team, it's a crisis, okay? Similarly in healthcare, we have a crisis. Patient is sinking, BP is falling, patient is gasping. So there's something called crisis resource management, and the first thing you do is scream or shout for help. You saw how his leader came? And he's giving feedback. They're having a discussion, a brief, that's one tool. Okay, they discuss on how they're going to manage that crisis. And then he gives encouragement. He tells them what to do. They cross and they complete their task. And then he has a debrief with his team member on what to do. Should we take it up to the queen, the admin? Should we do something about it because of that task? Is it clear? Sorry, you couldn't hear the dialogue. Hopefully it will start working now. It will? Because it gets connected through here. Yeah, no, it's just to increase the volume because I can hear it in the speaker. So that is about leadership, okay? You can see we finished team structure. Now we are discussing leadership. Leadership, a leader doesn't mean that he's supposed to know everything what's happening with the patient or with the situation. He's a captain of the ship who sees everything, delegates roles, okay? Now when the patient comes, I want you to do this, I want you to do this, I want you to do this. Now he's aware of his roles and responsibilities in the team. Whatever he does, he can't do, he relays it back to the team leader, and the team leader informs it to the whole team. So the leadership with constant encouragement, with feedback, with constructive intervention is going to see that the team will reach its goal. Now he's desperately trying to put a line. He doesn't know what's happening on the head end. So the team leader's responsibility is to see that everyone working in the team has some idea what's happening with the patient. That is called shared mental model. Are you all following me? Okay? Because we are doing a plan of care, we are not reaching our goal, we have to have a backup plan. And who does all this? Team leader, to see if we are reaching the goal. There's knowledge sharing happening. So two tools are there in the toolkit of leadership. One is brief. What do you do in the brief? These are the things we discuss in the brief. Who's on our team? It might be a time-limited team. Who's on our team? What roles and responsibilities are there? What is our plan of care? How are we supposed to manage the strategies? No. after the task is done, okay? After the task is done. Now this is a crisis for the AV team, imagine, okay? Now after my session, they should have a debrief on what went wrong, okay? How can they, the debrief will help them so that when the next speaker comes, they don't have the same issue again. So there's some quality improvement. You'll understand what I'm talking about. In your sports, don't you all always have a huddle? In between the session, in between the break, you have a huddle and then you change your strategy. That's also a tool. So you have a brief, you have a huddle, and you have a debrief to improve the team's performance. So 3 tools for leadership. Can you all repeat? Brief, huddle, and debrief, okay? So the Team Steps workshop is a 3-day course. I'm trying to finish it in 1 hour, hopefully if they also cooperate with me. Now we come to the most important aspect in a teamwork, which is communication. And when we say healthcare communication, you need it to be effective. If I'm just going to tell her, give this medicine, she doesn't know the dose, she doesn't know the route, she's scared to ask me. The other person standing next to her thinks, oh, this is not the medicine we need to give. There's a conflict there, but she's scared to talk to me because I'm senior. I presume she has heard. She presumes somebody else is going to give the medicine. Test my okay. Just one more slide, okay? So just watch this video, photo. Can you see a leg here? They were supposed to shift the patient together. There's some miscommunication, and the patient is on the floor. Lot of challenges in the healthcare setup due to communication. And during handoff, that is shift change, when the morning nurse hands off to the night nurse, 80% of the sentinel events happen during handoff. When an OBGPG is handing over to the medicine or the anesthesia is handing over, a lot during shift change because of the lack of communication, errors happen. Now, he wants me to test the video. Hopefully, you'll hear it. It's Steve Martin's movie where he's a neurosurgeon. The name of the movie is much way before you were born. So we'll just have a look at the video. ಅದು full ಉಂಟು. Happening here? Can you reduce it a little? Yeah. What do you think was happening here? They were communicating. He wanted her to call up the hospital, prepare the OT ready because he thinks there's a bleed in the head, and he wanted to keep the anesthetist informed. He wanted them to send an ambulance. A lot of information he shared with her. Smart lady. She repeated back the whole thing, and that was an important tool there, which is called closed loop communication. Okay? Morning, Dr. Reshma did that. She said, good morning. And she repeated it again. She said, say good morning. You all said good morning and gave it back to her. There was a loop. She was the sender, you were the receiver. And now she was clear that the message was understood by all because she got a feedback from you. That's a closed loop. That happened here. What were the other problems with this video? The girl tried to tell him a diagnosis. He's a neurosurgeon, man. Neurosurgeons are the utmost hierarchy in our healthcare system. They deal with the brain. And that hierarchy was a big communication challenge because there was no knowledge sharing there. You understood what I'm trying to tell you? So in communication, I'm going to introduce, it's a huge topic, it's a 2-3 day workshop. Just 2 tools I'm going to introduce. Till you retire from healthcare service, please do not forget this tool. It's called S-bar. S is for situation, B is for background, A is for assessment, and R is for recommendation. I'll explain it further. We have also introduced an I. I am Lulu. Is it Dr. Reshma on the line? It's regarding a patient called X. Okay, so the I part is over. My PG calls me. My son answers the phone. He goes on, ma'am, the patient is bad, come to casualty, blah, blah, blah. And then my son goes, eh? It's a crisis. Make sure the interns calls and tells, ma'am, please come here, the patient is bad. Come where? Where should I come? You know, Father Muller campus, no? From one road to the other, it's so huge. Situation, why are you waking me up at 2 a.m.? Why am I calling Reshma when it's, you know, midnight, 2 a.m.? She should get up from her sleep. Use words like, patient is not breathing, patient's BP is crashing. Reshma is going to get up. Background, ma'am, this is the patient you saw yesterday or you operated yesterday, blah, 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 blah. Give a short, brief background. Assessment, ma'am, on assessing, the patient's BP is so much, airway is like this, pulse rate is so much. Recommendation, I'm worried about the patient, Reshma. I want you to send your postgraduate to come and have a look. Meanwhile, recommend, can I ask for blood? Can I take an ECG? Can you follow what I'm trying to tell you? So the R is, you are recommending something, you're requesting something. Then Reshma is going to tell me, okay, Lulu, you shift the patient to ICU and get an ECG. I'll reach by then. So I have to read back. She wants me to shift the patient to ICU and then take the ECG. So I'm going to read back, or she might tell me some drug which I might not know. I'm going to tell her to spell it out to me. Make sure you do that when the postgraduates tell you to give some drug or write some drug in the discharge card. You're not expected to know all the drugs. Tell them to spell it out. Ask them for the route. That is a read back. And this is how we make sure that some information about the patient is handed over. Most important tool in healthcare communication, IS-bar. Okay, there are many other tools. We found this a little more comfortable to use. Now what I want you to do is, I want you all to pair up, okay? I want you to pair up. Now what we're going to do is, you have been asked by your teacher to book this hall for today's session, okay? Or I'll make it a little more interesting. I have told you to book Audi 4, City Center, Sahu. You all go there and you find out that Father Muller's has already booked the whole hall. Now you are conveying this information to me. Imagine the partner sitting next to you is doing, okay? And you're conveying it to her through IS-bar. You're going to introduce yourself, identify who the person you're talking to is. You're going to tell the situation that you didn't get the hall. You're going to give a little background why you all didn't get the hall. You're going to assess the situation, if any other halls are available, any other theater is available, different timing. And you are going to request for something. They can book the hall only if the teacher gives permission or they get, advance payment. And you are going to recommend and request them to do the needful. Can you all do that? Use IS-bar. Practice. The time starts now. Make pairs. Okay, there are 3 here, so make pairs. She's there alone, sitting. Can call that girl here, back. Okay? Use IS bar and converse with each other. Are you all done? Are you all narrating the whole story of Sahu? So you got the practice? You keep practicing, you'll know how easy it is. Even if it's in your hostel, whatever, try using this acronym to convey information. Done? Any clarifications? Okay. Now this is something I told you, the second tool, check back or closed loop communication. When you delegate something to somebody, make sure that the receiver has understood. Get it back, okay? Close the loop for your communication. Very, very important in healthcare. So whenever you communicate, make sure that it is heard, it is understood. Don't presume that the person listening to you knows what you're talking about. Now we come to the next competency, situation awareness, situation monitoring. How many of you have watched this video? It's there on YouTube, Monkey Business. Anybody? Okay, so pay attention.
The monkey business solution. Count how many times the players wear white pass the ball. Spot the gorilla. For people who haven't seen or heard about a video like this before, about half is the gorilla. If you knew about the gorilla, you probably saw it. But did you notice the curtain changing color or the player on the black team leaving the game? Let's rewind and watch it again. Here comes the gorilla, and there goes a player. The curtain is changing from red to gold. Looking for a gorilla, you often miss other unexpected events. And that's the monkey business solution.
Okay. This happens in healthcare most of the time. The patient is bad, and you can see somebody from my fraternity trying to tube the patient, okay? Patient is sinking, you're trying to put a tube so that you can give breath. I'm so concentrated and staring at that man's vocal cords, I don't realize that his heart has stopped beating because he's deprived of oxygen. So there are errors which are called fixation errors, where, and it has happened, there's a famous video which I'll discuss in some other session hopefully. So situation awareness and monitoring is very, very important in a healthcare setup. You should be aware of what's happening around you, what's happening with the patient, what's happening, and one tool you have by team steps is something called STEP. Very easy to remember, STEP. The status of the patient, Status of your other team members, whether they require help, they're finding it difficult. The status of the environment, what's happening on the monitors, is the defib charged, or whatever is happening around you. And is your strategy progressing towards the goal? So situation awareness, you needed to be, you remember in the last game you played, you needed to be aware of what's happening so that, when you get the ball in your hand, you know when to pass it on. Now there's something called cross monitoring, because as I said, we all are human beings. My son might have been sick whole night and I'm on duty today. I've not slept. It's a human factor. You'll had a party in the night. You'll have a hangover. Your cognition is not going to work as well. You're on some medications, antihistaminics for your cold, whatever. So there is another tool called I'm Safe Checklist. And you tell your colleague, just make sure that you go through my discharge card if I've written it properly. Cross-monitoring should always be done in a team. Is it clear? Okay. It's okay to say I'm held up. It's okay to say, because in the end, patient's life is more important than your ego or insecurity. We come to the last one, mutual support. You'll have watched the movie Minions. From your laugh, I can understand. Let's see how this goes, and then we'll have a discussion. Okay. You saw the mutual support taking place there? All of you saw the mutual support taking place there. This is another common thing, especially when you're in an interprofessional team, okay? You need to offer and also ask for task assistance. I'm not getting a cannula, can you please help me? Nurses are very good at that. Don't get egoistic, okay? The patient's life is at stake. Task assistance. If you are around as a member of the team or a team leader, provide feedback, which is respectful. You are not compressing the chest at the right rate, please do it. Not push her and say, I'll do it. Constructive intervention, mutual support, very important. Two tools you have, okay? Feedback and task assistance. Now you saw the other guy in the Minions video who was making fun of them. You get characters like that in your healthcare team, okay? You are giving a plan of care and the other person is not aware. Or they have a different plan of care. Hierarchy is so much that you feel they are not listening to you, or their treatment might harm the patient. There are conflicts that occur in plan of care, especially in interprofessional team. Surgeons will think, I'm the king, okay? Medicine will think, you have that. And the nurses always have a hierarchy that whatever the PG says is right. Probably, he doesn't know what he's talking about. So when you have conflicts in healthcare, remember one tool, not the cuss word you'll use for abuse, but this cuss word. Tell that person, try to tell the person, I am concerned about the patient. I'm uncomfortable doing this order or giving this drug or, doing something because it is a safety issue. Once or twice you tell them, then they will pay attention. The nurse will say, I think you're giving the dose wrong. So he's going to say, I'm the doctor or you're the doctor. There's a conflict there. So this cuss word and repeating it twice will at least make them think, okay, now let me pay attention and let me at least go back and check if that's the right dose. So you are stopping the line there from somebody making a mistake. Cuss word. So with that, we come to the end of the teamwork. Before I go into IPE, the interprofessional part of it, these domains, you all are clear? In the most, this is the shortest and simplest way I could put those competencies. Each of these are a one-day workshop. in team steps. Is it clear? A few tools you remember? When the session is over, you all will remember something, being a member of a healthcare team. And most important thing, do not forget the patient. Okay? A patient is a part of your team. Include him or her in the plan of care. Talk to them, take their consent, inform them what's happening with them, inform the bystanders. They will have a lot of questions. We don't have time. But make sure, because tomorrow, with the present situation, you'll either be lynched or you'll be shot. Y'all are reading the papers, right? You know what happened in Assam. So just, at least for your safety's sake, make sure that you are talking to them and bringing them in your loop. Now, you told me a lot of people who are working. Just like how you're having an orientation class here, the new nurses are having a class, physiotherapists, all the allied are having a class. And I'm telling you, you should work with the nurse, you should work with the physiotherapist. But if you are studying together, you have no idea what their roles and responsibilities are. They have no idea what you're supposed to do. The postgraduates come and tell me, ma'am, the nurses are always resting. They have a rest time. The nurses come and tell, it's morning since we told discharge and they are not yet come to write the discharge card. They have no idea what the others are doing elsewhere. And that has caused a lot of errors because we can't work. We expect you to work as a team without teaching you how to work in an interprofessional setup. And that's where your interprofessional education comes. In a healthcare, when you work, when you learn from, with, and about each other, you end up improving healthcare outcomes for the patient. Okay? That's interprofessional education. We are trying, a lot of us are trying to bring it into the curriculum, trying to do some difference, and try to get you all to at least study together so that tomorrow you can work together better than how we are working together now. So now you all understood what's interprofessional education? Because interprofessional education is required to improve the healthcare outcomes. And when I say interprofessional education, there are various disciplines. We interact, we do talk to the nurses, we do talk to the social workers, but the loops should be overlapping, okay? Now that interprofessional teamwork has competencies, and why we want to introduce it here, our healthcare system is now in silos, we are fragmented. You introduce it here, we learn to work together, there is interprofessional collaborative practice, and there is improved health outcomes. That's why we want to introduce it here. Just like your teamwork competencies, you have interprofessional teamwork competencies, values and ethics related to each profession where all your mutual respect and all that comes, interprofessional communication practice, and clear roles and responsibilities. I know my role when it's regarding the patient. I should also know what the nurse's role is. It has shown to improve patient outcomes, patient satisfaction, decrease healthcare cost, and the provider satisfaction. Even I feel like, okay, fine, you know, there is a teamwork and the patient is benefited. So provider satisfaction. With that, IP, just to tell you what is interprofessional education and collaborative. Now we come to the end of this session before I show you a few photos of the Simulation Center. Each bench, just identify some tools and competencies what I taught. Okay? We'll show this video. 2 are there. Just note down what competencies you have learned and just read it out to me after the video. Watch this movie? Yes. So you all should know. Okay, sorry for the violence. What competencies did you all see here? Randomly, each bench. Leadership, okay. Huh? Teamwork, okay. Planning, yes. What tools? Brief? Was there a brief? Before they wanted to steal the jeep. So there was a brief. Was there role delegation? You do this, you do this. Okay, everyone was very clear on what they had to do. Then, coordination, okay. You can look at the board. What about this? Was it there? It was effective? Okay. Situation awareness of what's happening? No, that man is going to give the case and they had to do it before that. There was some situation awareness. Mutual support? Okay. And you even saw one precedent that there was a lady in the jeep. Okay? So sometimes in healthcare we get unanticipated events. Okay. So this video I showed because there's something very important in teamwork. Like I said, crisis resource management. First thing you do is call for help. Don't miss the early warning signs. Always have a backup. Leadership, role delegation, okay? That's why I had to show you this video, because that's the thing that mostly happens during healthcare. They don't come and say the patient, you know, hello, in next 10 minutes I'm going to sink. So you should be aware and you should have a plan. Anything regarding this discussion before I show you a few photos of simulation? Maybe a few minutes. Because learning happens when we reflect on what we have learned. Any comments from your side? Do you think our learning objectives are met? Anybody thinks otherwise? Unless you practice teamwork, practice these competencies, you won't be able to apply it. Any discussion? Anybody? Different point of view? Nobody? Okay. After watching that video, how many are scared to fly? Raise your hands. No? Nobody? Not to fly the plane, to sit. Okay. Those who are scared to sit in a plane and fly, with all the medical errors I'm telling you, it's safer to sit in a plane than come to a hospital. Seriously. The number of patients who die every year is equal to, jumbo jet means they can carry around 800, I think, odd patients crashing every week, 4 of them. Evidence shows this. So now you know the impact of healthcare errors I've discussed, and we found out the root cause due to teamwork and lack of communication. Now how do we teach you this? There are a lot of methodologies, didactics, role playing, you know, seminars, bedside clinics, there's so many things. Why is it safer to sit in a plane? They're also human beings, the pilots who are sitting. She's not yet a celebrity. She's my colleague. She handles the pre and para simulation sessions in our simulation center, Dr. Nicole. With her permission, I've put up the photo. You know where she is? She's not in an actual plane. She's in the Bombay airport where there is a simulated cockpit. Okay, you give 1,500 rupees, they'll let you enter. So she just said, I'm a healthcare simulation educator, they'll let her enter free. Now you know the Q word. Anyway, every pilot is supposed to sit in a simulated environment and, you know, crash land on water, engine fails, they're supposed to do that, and then they get their license. Every year, they have to undergo simulation sessions to fly a plane. So why not us? We are dealing with so many patients. I haven't entered or given anesthesia for the last 4 years, okay? Because I'm heading the simulation center. I'm only teaching now. I left my clinic practice. I have nearly 17 to 18 years of anesthesia practice. Tomorrow, will you be confident in me anesthetizing your mother? So who's testing my competencies here? If a crisis occurs, who's testing it? So similarly, we borrowed from aviation industry, the simulation, healthcare simulation. It's nothing but the facilitators are creating an experience for you, which we will be guiding. You are immersed in that experience, and that is mimicking an operation theater or a casualty or, you know, some asthma patient, anything. Why? To achieve educational goals. How do you manage a patient with asthma? We're going to put you in that scenario. We're going to use technology. We might use actors, because communication is better when there are simulated actors, and that is simulation. That's all. It helps us to train you in all these competencies in a non-threatening environment. Now, when you are put in a situation, you have to think, okay, is this asthma? Is this something else? You're thinking, this critical thinking. Should I call the doctor? Should I give this medicine? Should I do that? You're taking decision making, you're reasoning. And that we can enhance those competencies when you are doing simulation. That's one thing good about simulation. In a safe, non-threatening, safe for you, we know you're going to make mistakes, safe for the patient, we can kill the mannequin any number of times, and you will achieve your goal. In a professional manner, if you include the nursing students also, we have an interprofessional simulation there. When I say skills, it's not just, you know, your psychomotor skills. All these skills are important, and all these skills can be targeted using simulation education. Doesn't mean you don't need theory, because we are not teaching you there. You will have your theory, you will have your clinical practice. We are somewhere in between. Okay, we make you more confident, more competent, and more prepared to face a clinical environment. It's half a minute. Just see what our two interns are doing. They've passed out now. Okay, so we just gave them the scenario. They are immersed in it. They are interns, they are PGs, and we were doing code blue simulation here. Okay, I didn't play the whole thing because it's not required, but you understood what they're doing. Now we watch them. We have a performance checklist, and then we have a discussion called debriefing after the session. And they tell us, you know, how they can. So when you do, you learn. I can give you a recipe to make an omelette, but I'm going to give you a stove, a frying pan, an egg, and, you know, all those things. And you have to do it. You learn better when you do. Agree? Yes. And probably I might switch off the gas, or I might break the egg and give you more challenges. So as your level of learning increases, we increase the challenges involved in managing the case. So you are experiencing something, you're reflecting on what, then you are like, oh, okay, so when this happens, you know, you have, your concepts are cleared, and you are hopefully implementing it in the clinical. We bring you to the simulation center. We tell you some ground rules of how you're supposed to behave. We brief you regarding the patient. We orient you to the mannequins and crash cart or, you know, ventilators. We have already put the scenario in, we play it out, and then we have a debrief. This is a cycle of simulation that happens, which you will be experiencing when you have simulation education. That doesn't mean you need high tech. We use the simulation center for basic skills like hand washing. We use hand washing, how to gown. All our nurses, everyone comes to the center, how to tube. These are pediatric interns. Cannulation. Now, we want to do, like, you know, take his permission, his consent. So this is not his hand. He's my technician, Pradeep. The hand is the mannequin. So he'll be talking, and the hand they're going to poke. So we have a hybrid there. So we teach them communication, consent taking, how to defibrillate, how to put an ICD tube, how a few students come and say they've not seen breech, they've not seen PPH. We have a birthing mannequin, ultrasound, surgeries, teamwork. These are our nurses and doctors. We are having a faculty interprofessional teamwork here. A pediatric patient coming to casualty, and we assess their non-technical skills. Disaster with code blue. We take our trainers to the lab. These are phlebotomists. So we do training there. That's me. I'm refusing to give consent for general anesthesia. I'm sorry, spinal anesthesia. I'm telling, don't poke my back. They're going to poke this. She's my anesthesia PG. And how she convinces me and takes consent. We do it through simulation. A trauma workshop, once what we did. Post, we had a PPH and an obstetric workshop. Our nurses, our orderlies, like you were saying, akkas and annas, how they shift. This is a low tech, it's just a doll. It doesn't have, so to teach them how to shift on wheelchair and all that. And the feedback we get, this is an interprofessional team. The feedback we get, everyone likes coming there because it's obviously fun. But also, all of them say that teamwork and communication, it benefits them. How to talk on the phone, how to use IS bar, we test it with that. And that's why we are bent upon introducing simulation-based workshops are happening, but simulation-based interprofessional. Why? Because if not for the patient, at least for your sake, make sure they don't sue you because of the healthcare errors taking place. Any queries? Okay. So, on time. Any queries? Any discussions? I think Reshma has an announcement. No? Okay. Anybody? Anything? Yes, ma'am. You can sit. Yeah, you can sit. No, it's okay. Okay, fine. Yeah, so one, stimulate. Okay. Let's get to practice saying simulation because I think even your college is going to get a simulation center. So, yes, simulation methodology stimulates your learning. Don't worry, we took 2 years for all our faculty to stop saying stimulation center. Okay? How do you simulate drawing blood? We have trainers here, okay? IV trainers. You saw the hand there? You can fill up, there are tubes inside, silicone. If you press, blood will come. Okay? Any other doubt? Anything? So that I feel okay that, okay, something is, some critical thinking is taking place. Nobody? No?
Anything about the session you want to say? Anybody? Just raise it.
Good morning, dear. Yes, it's still morning. Thank you so much. Just a request, because something called attrition of skills. Unless you practice what you're doing, okay? It's very easy. Maybe hardly a few will remember when you leave the door what I said. A few will forget in maybe a month. But by 2-3 months, everyone's going to forget everything. Unless you are one of the, Superman or Avengers who have didactic memory. So, what you need to do is try to implement what you're learning over the course, not just my session, whatever sessions we are taking for you. You get the opportunity to learn, don't take it for granted, okay? There is a reason why we are telling you things. So take that opportunity, try to implement it, explore. You have beautiful 4-5 years to explore because the minute you enter internship, your responsibilities increase. So now it's your responsibilities to make use of those opportunities and explore. Use the patient to learn, okay? And be very, near the patient. We always tell, when you're posted somewhere, after a few years we take for granted. This is one request I always tell the students. Be very aware, the patient is listening to you. The bystanders are listening to you. They're watching you. So be very aware. You giggle, you book your show, go to book my show, go do anything away from the patients. Okay? That's a sincere request. So thank you so much. Thank you to Reshma for inviting me. Okay? It's always a pleasure to stand and talk to students, especially from the healthcare. Thank you so much.
Thank you so much, ma'am, for driving the point of interprofessional education in a very concise but very effective manner. So she needs a big round of applause because she's too busy and she's fixed a slot for us. That's a big thing. So you can write your reflections in the book, same 3 questions. just wants to reflect. Please sit down. So we just took a topic on interprofessional. So we have interprofessional. Our her own. Why? Because she's a third year BDS student. And why her? Because the topic for now is power of social media in healthcare. She has an Insta page called as Brush Your Teefies, okay? You have to see her page, how beautifully she gets medicine and she posts stories on it, very interesting. So she's going to talk of how interesting you can make social media and you can use it as a tool in providing healthcare. Okay, so she's Miss Asta Vaz and she'll be talking to you on this topic.